welcome to my channel. My name is Jazzy RN. I have been a remote utilization review nurse for over 9 years, and the goal of my channel is to help nurses pivot from the bedside to remote work. This company is with CVS Health, and they're looking for a case manager. You must be an RN living in the state of New York, and you must be an RN license in New York. These are requirements. So as always, at first I go to the requirements needed for the job before I apply to it. So you must have an active and unrestricted RN licensure in the state of New York, proficient in Microsoft Office Suite, that includes Word, Excel, Outlook, OneNote, and Teams. Now, if you don't have OneNote experience, you can find information about that on LinkedIn Learning through your job. Most companies do have LinkedIn Learning courses available that are free for the employees, or just Google search it, as well as you can look up YouTube videos about OneNote, as well as Teams. With the ability to effectively utilize these tools within the context of case management RN role, access to a private dedicated space to conduct work effectively to meet the requirements of the position, confidence working at home, independent thinker, using tools to collaborate and connect with teams virtually, a minimum of 3 years of nursing experience, and minimum of 2 years of case management, discharge planning, and our home health care coordination experience as well. And there's some more qualifications that are preferred but not required. And the education requirements, so they do require you to have at least an Associates of Science in Nursing, but they do prefer you to have a Bachelor of Science in Nursing. And you must have an active and unrestricted RN licensure in the state of New York. This next company is called Cadence, and they happen to have multiple roles that are open and all are remote for LPNs, RNs, nurse practitioners, as well as medical assistants. This includes states such as Hawaii, California, and more. So for this first role we'll go over is an RN in Hawaii, and just a little bit about the position. Cadence Health is seeking a care management registered nurse to support patients enrolled in our advanced primary care management program. In this role, you will proactively monitor patient data, evaluate clinical information, and deliver timely interventions to promote patient safety and improve health outcomes. You will work closely with interdisciplinary care teams to reinforce care plans, support medication adherence, close care gaps, and provide patient education that empowers individuals to actively manage their health and chronic conditions. And they do require an active Hawaii RN license. The role is Monday through Friday. It's from 8 a.m. to 5 p.m. Hawaii time. They give you a list of your tasks, which you'll be doing for the job. And as well, always what you need: an RN compact state licensure and a single state RN license is needed. They require an associate's degree in nursing, 5 years of recent clinical experience as an RN in an ICU setting is preferred, but not required. Prior experience supporting patients in a chronic care management program is a plus, and so on. The next job is a medical assistant, and you must be located in Hawaii. And for this position, its schedule is full-time. You must be remote based in the United States, and the title says you must be based in Hawaii. The working hours are from 8 a.m. to 5 p.m. or 9 a.m. to 6 p.m. in the Hawaii time zone. They give you a list of what you'll be doing as a medical assistant, as well as education, licenses, and experiences. So you must be located in Hawaii, have an active medical assistant certification, either the AAMA, AAH, AMT, NHA, NAHP, or NCCT is required. They want you to have at least 5 years experience as a medical assistant. They want you to have remote work readiness. So they want you to have a stable high-speed Wi-Fi, which is required, experience working in internal medicine, cardiology, nephrology, or with the geriatric population is preferred, and experience providing patient education and support to individuals managing chronic conditions is preferred. The next position is also medical assistant, and this is a bilingual position. It's Spanish speaking. And this one does not mention which state you should live in, but it is a remote position based in the United States. And the hours are 8 to 5 p.m. or 9 a.m. to 6 p.m. Pacific time zone. They give you a list of what you'll be doing as well as what you'll need. So the exact same licensing information as the prior job. And they do require you to have Spanish. Have Spanish as your fluent second language. This next role is for LVNs, and they require you to have a California license. And this position is remote based in the United States, but you must be in California. The hours are 8 a.m. to 5 p.m. or 9 a.m. to 6 p.m. Pacific time zone. They give you a list of what you'll be doing. And they give you a list of education, licenses, and experiences that are required. So you must have a compact multi-state LVN, LPN license in the state where you currently reside is required. At least 5 years of clinical experience as a licensed practical nurse is required. Remote work readiness. So they want you to have stable, high-speed Wi-Fi required. An active California LVN license is required. Fluency in Spanish is preferred. And experience providing patient education and support to individuals managing chronic conditions is preferred. And the last job is an LPN position in Hawaii. And for this position, it's also full-time based in the United States. You must work from Monday through Friday, 8 a.m. to 5 p.m. or 9 a.m. to 6 p.m. the Hawaii time zone. They give you a list of what you'll be doing, as well as education, licenses, and experience required for this role. So you must be located in Hawaii and have an active compact multi-state LPN, LVN license in the state where you currently reside is required. At least 5 years of clinical experience as a licensed practical nurse is required. Remote work readiness is required. An active California state LVN license is highly preferred. And experience providing patient education and support to individuals managing chronic conditions is preferred. This company is OSF Healthcare and it's based in Illinois. So you'll just go to their website, osfhealthcare.org, and you'll look for careers. And what I did was just Control F, move this over here, Control F, type careers, and you'll see OSF careers here. Then the page will change and you'll see this page here. If you scroll down to the center, and right here I just typed in remote and then find jobs. Now this first job I found was an RN virtual advanced care. Now just a FYI, for this job, they do require you to start off training in person. So right here it says the remote. This position is fully remote after training and orientation is completed. Now my first RN job, remote job, was this way. We actually trained for 10 months in the office, and then once the 10th month came around, we just gathered our laptop, all of our computer accessories, 2 monitors, keyboard, etc., and brought our equipment home. And we've been home ever since. That's actually my first job. I actually was there for 7 years. So this sometimes does happen where your remote job may start you off working in the office, and then once you finish your training and orientation, then you can bring your equipment home. And some companies have it to where they just ship your devices out to you. So you may get 3 boxes of equipment. So one box may have your laptop with your mouse and docking station and keyboard and headset, and then the other 2 boxes each will have a monitor in each box. Or the company may send you just one huge box with all the equipment you'll need for the job. Just a little bit about OSF Healthcare. This position is hourly, and here's the rates, and it's based on years of licensure. And a little bit more about the position. It is remote working at the discretion of leadership after training and orientation is completed, and applicants must have an active RN Illinois license. They do require you to have a nursing degree with 3 years of recent RN experience. Your licensure must be RN licensure in Illinois required before hire. Michigan licensure required within 6 months of hire. Other skills, they want you to have excellent interpersonal and communication skills, solid computer skills, including proficiency with Microsoft software. Just make sure your resume has Microsoft Office or Microsoft 365 on your resume. They want you to have strong analytical and problem-solving skills with the ability to be detail-oriented, working knowledge of Windows-based computer applications, including electronic EMR, and digital communication platforms. I do believe that this hospital may actually use Epic for their EMR, electronic medical records. I'm not really sure, but all the experience that you have regarding electronic medical records, whether it be Epic, Cerner, Protouch, Meditech, etc., make sure you add those platforms that you are knowledgeable of on your resume. And they do prefer you to have a bachelor's degree in nursing and experience with ambulatory and chronic illnesses as well. This company is Northwestern Medicine Catherine Gratz Griffin Lake Forest Hospital. It's very long. And they're looking for a case manager RN, utilization review, casual weekends. Now, this is based in Lake Forest, Illinois. It was posted one day ago and only 10 people clicked apply. I did try going to the website for this hospital, and on LinkedIn it was lfh.org, but for some reason the site couldn't be reached. I'm not sure why, but we'll just keep moving forward. Now, this says on-site, but I want to show you something about this job. Now, even though it says on-site here, if you scroll down some, in the description it says, this is a casual, non-benefited position supporting our case management yard department at Northwestern Medicine, Catherine Gratz Griffin Lake Forest Hospital. This role will be working remotely with requirement to work every other weekend, which is Saturday and Sunday. Now, this job is a very long title, as well as the title of the hospital. And to work every other weekend for this job, it seems like you'll be doing a lot of training on the front end to get you comfortable with working every other weekend, because it's not a very consistent schedule. So basically, you will be a case manager RN, and you are bed planner. Now, as always, I go straight to the qualifications. You must be an RN license that's issued by the state of Illinois, a bachelor's of science in nursing, at least 2 to 5 years of patient care experience in a hospital setting, able to multitask quickly and process multifactorial stimulation accurately. I have no idea what this multifactorial stimulation would be, but this is actually a hospital utilization review nurse, not an insurance company utilization review nurse. And you also are doing case management. Critical thinking skills, decisive judgment, and the ability to work with minimum supervision, and past experience in admissions, utilization review activities, discharge planning, and our case management. Now, even though you don't have prior experience with this last bullet point, I just want to make sure that if you do, let you know that if you do find any jobs that are, if let's say you are filtering remote on LinkedIn and you see on-site, do a little bit more research into the job to see if the job really is on-site or if it's actually is remote and it's some kind of maybe clerical error on whoever posted the job. As you can see right here, it says on-site, but when I go right here, it says you're working remotely. And it also could be that maybe you may start working on-site during your training and orientation, and then once you're done orientation and training, then they'll let you work remotely. I also want to focus here where it says preferred. So they do prefer you to have utilization review experience, Master's of Science in Nursing, which is absolutely not needed. Most of the nurses that I work, basically all the nurses I worked with, maybe one or two may have a master's degree, but all the nurses either have just an associate's degree in nursing, a bachelor's degree in nursing, and there are LPNs who work in nursing as utilization review nurse. There are even supervisors who are LPNs in utilization review. So this preference of a master's degree is absolutely unnecessary. This next bullet point, membership in professional nursing organization. The 3 companies I've worked for have never required or even inquired about a professional nursing organization membership. And last, the certification in case management. I don't work case management, I work utilization review, but even the jobs I've seen for case care management or case management, I haven't seen requirements for certification in case management. Now they actually have to teach you first, and then you can go for the case management certificate, but it is absolutely not necessary because whatever company you work for, they will train you on how to do your job. I'm going to go back up to the very top of the job description. This is very, very long, these responsibilities. Of course, you are not providing direct patient care, which is nice, but you're doing a lot more as a hospital utilization review nurse than you would as an insurance company utilization review nurse. So right here where it says, I want to point out this one, you are serving as an access point resource for physicians, staff, and patients. On the utilization review nurse side, we rarely ever get phone calls. When we do get phone calls about the patients, it's never the patient we're speaking to or the patient's family members. It's always someone in the hospital, a nurse, maybe a doctor. Someone's calling to confirm about a denial and they want to know why it was denied. Now, denials are out of the nurse's hands because only a doctor can deny an authorization. So that goes to the doctors regarding a peer-to-peer or appeals department. But any kind of resources for physicians, that's the basis of utilization review on the insurance side. I also want to point out this job also has, consults with physicians in assigning admission level of care status. Now, on the insurance side, it's up to the doctor on whether he or she wants to admit the patient and admit him or her at the acute level of care, intermediate level of care, or critical level of care. Or if the doctor decides we don't need to admit, we're just going to do an observation stay. So what you're doing on the hospital side is a little bit more than what you'll be doing on the insurance side regarding utilization review. And this job is not just utilization review, it is case management as well. So just make sure that whenever you are filtering your jobs out on LinkedIn, and you may see a job that says on-site but was filtered using remote, just do a little bit more research to figure out if the job really is on-site or if it is remote or maybe it's hybrid. And then sometimes some jobs have it to where you start off in the office and then you can work remotely. So just an FYI, make sure on LinkedIn you're reading the job description thoroughly to make sure you're not passing on an opportunity.